The next drugs we're going to talk about are monoamine oxidase inhibitors, which have the abbreviation MAOIs. MAO is the chemical, and this drug blocks that chemical that would break down the monoamines. So monoamines include the neurotransmitters norepinephrine, dopamine, and serotonin. So don't get MOA, which is mechanism of action, confused with MAO. All right, so the enzyme monoamine oxidase, or MAO, is found in terminal neurons, also in the liver and the intestine, and there are two forms. There's subtype A and there's subtype B. The monoamine oxidase inhibitors will block the action of the enzyme monoamine oxidase. So when that happens, it stops the breakdown of those monoamines in the synaptic cleft, so it leaves them available for more happy hits. So MAO type A is used in the treatment of major depression and preferentially interferes with the metabolism of norepinephrine and serotonin. But when we block it, we can also block other monoamines. Interfere with the degradation of the monoamine transmitters, also dietary amines like tyramine. When we use an MAOI, this inactivation is blocked, and it results in excess amounts of norepinephrine, serotonin, and dopamine to be available for more activity and binding with those receptor sites. So the effects produced by the blockade of, there are effects produced by the blockade of the enzyme MOA. And what happens is we need to think about foods that would also increase this tyramine, which could intensify the effects of that release of those monoamines. So these foods help produce monoamines. So people who take MAOIs need to avoid certain types of foods. That includes certain types of cheeses, especially ones that are aged, blue cheese, camembert, Swiss, meats, salami, bologna, alcoholic beverages, red wine, especially Chianti, which is considered to not be a very mature type of wine, sherry, dark beers, fruits and vegetables, dried fruits, raisins, things like that, figs. So also patients should avoid stimulants like coffee, tea, and chocolate because all of those things potentially could raise blood pressure. So the foods with tyramine, here's just a little visual for you that gives you some of the lists of some of the items. Peanuts, chocolate, grapes, raisins, soy, beer, pineapple, coconut, red wine. So the thing about using MAOIs is it limits the patient's diet very much. They have to be very conscientious to what they're eating. Also, MAOIs will interfere with a lot of drugs. So we don't use MAOIs as a first-line treatment. They're kind of a last resort drug. If we've tried the other drugs and they don't work, then we'll use it. Now, there are some exceptions, but generally not in depression as to when we would use an MAOI. Now, MAOIs have both could be reversible or irreversible. It takes 3 to 5 days for an MAO level to reach its normal after we stop the MAOIs. So that can take a little time. The elimination of the drug is very slow. They have very long half-lives. Recovery can take up to 2 weeks when irreversible MAOIs are administered. So the irreversibles stay there longer and that means that they're going to have more potential for interactions with other drugs. So if somebody's on an SSRI and we're going to switch them to an MAOI or vice versa, generally the patient needs to be off either of those medications for at least 2 weeks before introducing the new medication. The side effects of the monoamine oxidase inhibitors include sedation, dry mouth, urinary retention, and constipation. So those are the anticholinergic side effects. Oops, I keep wanting to cross my T's. I guess that's not going to let me take that back out or cross my L's. That's an L, not a T. Also orthostatic hypotension. So we want to warn our patients, don't stand up too fast. It can cause impotence and it can cause a weight gain. Now, the biggest concern with the MAOIs is because of the increased levels of norepinephrine and the stimulation that can have on the heart, it can cause a hypertensive crisis. And a hypertensive crisis means their blood pressure can go up so high that it could actually be fatal. The warning labels for the MAOIs: avoid alcohol, may cause dizziness or drowsiness, and do not discontinue without medical supervision. Now, the two drugs that are sold in the United States include phenelzine, which is Nardil, and tranylcypromine, which is Parnate. Tranylcypromine. So these are the two MAOIs used to treat depression. As I stated on a previous slide, we do have some other MAOIs that have other indications, but they're not used in treating depression. For some reason, I have my food side on this one as well. So the hypertensive crisis can be fatal and is caused by drug-drug as well as drug-food interactions. So again, avoiding those foods with tyramine to help prevent the risk of the hypertensive crisis. The tyramine stimulates the release of norepinephrine, which could result in the hypertensive crisis. The patients need to be given a list of food and drinks that they need to avoid, and that list is also in your textbook, table 6.1, which is located on page 97.